an oral healthcare toolbox. In this lesson, we will take a deep dive into the home care habits that support oral wellness. You will learn specific oral health tools, such as fluoride and toothbrushes, that can support oral wellness. You will learn how these tools can be used with proper technique, and you will learn how to teach others about these tools and techniques. What you are about to learn about keeping the mouth healthy might surprise you, even if you've been to the dentist many times in your life. The main take-home message in this lesson is that what people do at home is the number one factor in keeping their mouths healthy, and that it is never too late to improve oral health. You'll notice a special feature of this lesson is that there are a few opportunities to pause and consider what you would do in particular situations. When a "what would you do" slide comes up, feel free to pause the presentation for individual thinking or a group discussion. Part 1. What are the home care tools? We will learn what the recommended home care tools are and how they should be used to support oral health. One of the most important tools in your oral health wellness toolbox is fluoride. You might have heard about fluoride before, but today we will take a closer look at this important ingredient. Fluoride is a natural mineral that helps strengthen people's teeth and lowers their risk of oral diseases. When used the right way, fluoride is not dangerous. In fact, fluoride is seen as one of the biggest public health successes of the 20th century. People usually get their fluoride from two sources: tap water and toothpaste. Let's start with tap water. Fluoride is added to many community water sources, giving fluoride access to millions of people throughout the U.S. Even so, there are several reasons why people may not have access to fluoridated tap water. There might be problems with the quality of local tap water, which forces communities to drink bottled water instead. Also, some people get their water from a well instead of the tap, especially in rural communities. Finally, some communities are fearful of fluoride and have opted not to fluoridate their water. Fluoridated water helps strengthen teeth enamel when the teeth are still growing, but it can be a problem in high amounts. A dental provider can help with advising patients about the right amount of fluoride for children. Next, let's talk about toothpaste, which is another important source of fluoride. When people brush their teeth with fluoride toothpaste, they are placing fluoride directly on their teeth. Brushing with fluoride toothpaste is a great way to access fluoride. But just like with tap water, there are several reasons why people may not have access to fluoride toothpaste. They might have a low income and need to spend their money on other purchases. They might not realize the value of fluoride toothpaste. And they might have heard from friends or read on the internet that fluoride is dangerous. When working in communities, one of your roles can be to understand the barriers people face in accessing fluoride and to help them overcome those barriers. You can also help people come up with questions about fluoride that they should ask their dental provider. Here is an opportunity to pause and consider what you would do in a particular situation. A person says that he read on the internet that fluoride is dangerous, so he only buys fluoride-free toothpaste that he says is more natural. What would you do? What facts might you share? Now that we've talked about fluoride, let's move on to toothbrushes. Toothbrushes are a very important tool in the oral health wellness toolbox. Over the course of the day, the teeth develop a sticky layer of something called plaque. Plaque is filled with the bacteria that eventually causes cavities and gum disease. So it's important to brush off that plaque every day. Toothbrushes can be purchased at a pharmacy, dollar store, or grocery store. Different toothbrushes cost different amounts of money, but a cheap toothbrush can be just as effective as an expensive one. The main thing to look for is how soft the toothbrush is. Some stores sell very hard toothbrushes, but it's best to get a soft or extra soft toothbrush. The reason to get a soft toothbrush is that it's easier to damage the tooth and the gums with a hard or even a medium toothbrush. Toothbrushes can be used on children as soon as their first tooth appears. Before babies get their teeth, their gums can be wiped using a soft, clean cloth. We wipe a baby's gums for the same reason we brush teeth, to remove the plaque and bacteria that can later cause cavities in their teeth. Now that we talked about toothbrushes, let's move on to toothpaste. Earlier in this lesson, you learned that fluoride is a natural mineral that helps strengthen people's teeth and lowers their risk of oral diseases. You might be surprised to learn that the main reason we use toothpaste is to apply fluoride directly onto the teeth. Just like toothbrushes, toothpaste can be purchased at a pharmacy, dollar store, or a grocery store. And also like toothbrushes, different toothpaste cost different amounts of money, but cheap toothpaste can be just as effective as expensive toothpaste. The main thing to look for in a toothpaste is whether it has fluoride. We do not recommend using toothpaste that has no fluoride. Also, avoid toothpaste made from charcoal. We also do not recommend making homemade toothpaste. Toothpaste should not be used on babies. Once children are older, grain of rice-sized smears should be used until the child is old enough to spit out the toothpaste. Here is another opportunity to pause and consider what you would do in a particular situation. A person says she cannot afford the toothbrushes and toothpaste available at her local pharmacy, so she does not brush her teeth. How would you start a conversation about this problem? What facts would you share? So far in this lesson, you have learned about fluoride, toothbrushes, and toothpaste. Another important tool in your oral health wellness toolbox is dental floss. You have already learned that plaque builds up on the teeth throughout the day and sticks to the teeth. Plaque is filled with the bacteria that causes cavities, and that brushing plaque off the teeth is important to oral health. But toothbrushes can't get between the teeth, which is where many cavities can start. That's where floss comes in. Flossing can scrape some of the plaque out from between the teeth, which means there is less bacteria in the mouth and less of a chance for oral diseases. Finally, let's talk about mouthwash. Mouthwash is not just a mouth freshener. Earlier in this module, you learned that the sticky plaque on people's teeth is filled with bacteria. Those bacteria can cause cavities and gum disease. So our overall oral health home care tries to lower the amount of harmful bacteria in the mouth. Mouthwash can help kill the bacteria that can cause cavities. Like toothbrushes and toothpaste, you can find mouthwash at a pharmacy, grocery store, or dollar store. Some mouthwashes contain fluoride, giving extra protection against cavities. So far in this lesson, you have learned about fluoride, toothbrushes, toothpaste, floss, and mouthwash. Many people want to know what is the most important thing we can do to take care of our oral health. In a perfect world, everyone would use all of these tools, but we realize that people do not always have enough money, time, or patience to do it all. So, if someone has to choose, they should be sure to brush the teeth every day with fluoride toothpaste. Part 2. How should people use the home care tools? So far, we've talked about the most important tools in your oral health wellness toolbox: fluoride, toothbrushes, toothpaste, floss, and mouthwash. Next, we will talk about how to use these tools. Believe it or not, there is a right way and a wrong way to use each of these tools. Brushing is an important part of preventing dental problems for all ages. The teeth should be brushed at least twice a day with a soft or extra soft toothbrush and fluoride toothpaste for 2 minutes. This helps to remove food and plaque, and fluoride toothpaste helps protect the teeth from cavities. It is important to brush before bed and after waking up because when we sleep, plaque builds up. Removing plaque by brushing it off is the most effective way to reduce it. Brushing the tongue also helps reduce the amount of plaque in the mouth. To brush the teeth, people should hold their brush at a 45-degree angle where the gums meet the teeth. They should gently brush with short, soft strokes from the gum line to the chewing surfaces of the teeth. They should be sure to brush all the surfaces of the teeth, including the chewing surfaces. They should also gently brush the tongue to remove plaque. People should brush their teeth for 2 minutes each time. Using a song or a timer can help encourage brushing for the full 2 minutes. Too much brushing can also cause trouble. Brushing too hard can cause receding gums and bleeding, and might cause the teeth to become too sensitive. Toothbrushes should be replaced every 3 or 4 months, or sooner if the bristles are flattened or if the person is ill. Toothbrushes should not be shared because that could spread the bacteria that causes cavities or other illnesses. A smear of toothpaste the size of a grain of rice should be used for children who cannot spit out toothpaste on their own. For older children at around the age of 3 and adults, a pea-sized amount of toothpaste is enough. It is important to not let younger children eat or swallow too much toothpaste. One strategy to make sure kids don't eat toothpaste is to use a strong minty flavor instead of a fruity or bubblegum flavor. People should not rinse their mouths after brushing because this rinses away the fluoride. People should spit out as much toothpaste as they can and try to avoid eating or drinking for 30 minutes after so that the fluoride can be effective. Dentures also need daily care to keep them clean and the mouth healthy. Dentures should be removed and rinsed after meals, in addition to be removed and soaked nightly. This is an important step in maintaining the dentures and a healthy mouth. It is important to remove plaque and food from dentures. People should also remove any denture adhesive from the dentures every day, as it can trap bacteria. After removing the dentures, people should brush the dentures with a soft toothbrush and a denture cleaner. Denture cleaner is not meant to be used in the mouth, just on the dentures. When people soak their dentures in denture cleaner, they should be sure to rinse them really well before wearing the dentures. Dentures should not be in the mouth overnight so that the tissues in the mouth can breathe. Not removing dentures at night can potentially result in problems like yeast infections in the mouth. Also, people should not use whitening products on the dentures. Now, you've learned how people should clean their teeth or false teeth, but even toothless mouths should be cleaned every day. For example, babies with no teeth should have their gums cared for every day. After feeding, babies' gums should be gently massaged with a clean, wet cloth. According to the American Academy of Pediatrics and American Dental Association, a baby's teeth should be brushed as soon as the first one erupts in the mouth, which is usually around 6 months. Adults without teeth should also clean their mouths. A clean, wet cloth should be used to wipe the gums to remove food and bacteria, and the tongue should be brushed. Using a mouth rinse can also help remove bacteria and help with fresh breath. Here is another opportunity to pause and consider what you would do in a particular situation. A person you work with has a new baby. You are not sure how much they know about caring for a new baby's oral health. What questions would you ask? What facts would you share? Now that we've talked about brushing technique, let's move on to flossing technique. Flossing is an important part of keeping teeth healthy. People should actually floss before they brush. When done the right way, flossing can help loosen and remove food and plaque between the teeth that can then be brushed away. Here's the way to floss. First, gently wrap the floss around the middle finger of each hand and hold with the thumb and index finger of both hands. Then, put the floss between the teeth. Wrap the floss in a C shape around the one tooth, being sure to drag the floss down under the gums until there is a gentle resistance and then up. Then wrap the floss in a C shape around the neighboring tooth and do the same. Remove the floss and insert between the next two teeth and repeat. Unwrap floss from the fingers to use clean sections of floss. Children's teeth should be flossed too. There are flossing aids that can make it easier to floss children's or adults' teeth. Part 3. What is my role? So far, we've talked about the most important tools in your oral health wellness toolbox: fluoride, toothbrushes, toothpaste, floss, and mouthwash. We have also talked about how to use these tools. Now, let's talk about your role in all of this. How should workers such as yourself help people make the best use of their wellness tools? When you work in the community, you will probably meet many people who haven't taken care of their oral health for a very long time. You might meet adults or children with severe decay and tooth pain. You might meet adults with few teeth or no teeth at all. Maybe they're thinking, it's too late for me to improve my oral health. I might as well give up. Or maybe they're thinking, I'm afraid of the dentist. In fact, I hate the dentist. I'm not going unless I have to. The bad news is, these worries can stop people from making changes they need to make to improve their health or the health of their children. And the shame people can feel about their oral health can make the situation even worse. The good news is, it's actually never too late to make positive changes. When you work with a community, you can play a very important role in someone's life. If you help them see that it's never too late. Scientific evidence has shown that if people start taking care of their oral health can improve no matter how old they are. If you can help someone see the value of brushing their teeth, or help someone overcome barriers to brushing their teeth or seeking dental care, you can make a huge difference in their life. Besides helping community members see that it is never too late to make positive changes, you might want to share some of the information you have learned in today's lesson. You can share information about buying a soft toothbrush, or about why fluoride toothpaste is a good thing, or about wiping toothless gums with a soft, clean cloth. You can even tell them about brushing technique. Right now, you might not remember all of the information we share with you today. That is perfectly okay. You are not expected to memorize all the information in today's lesson. If you are interested, you can go back and replay some of the topics you heard today, or you can look online to learn more. Here are two websites that are very helpful when you need to refresh your memory about oral health topics. The Colgate website has a tab called Oral Care Center. Under this tab, you can find information on topics such as oral health at different life stages, nutrition and oral health, brushing and flossing, dentures, and dry mouth. Remember, as a community worker, it is okay to say, I don't know. If a person asks you for specific guidance about a topic, like the properties of fluoride or toothbrushing technique, it is okay if you do not remember or if you do not feel comfortable giving health advice. You should only provide information that you feel confident about. If health education is not part of your scope of practice or level of comfort, you can give people oral health flyers or brochures from sources like the American Dental Association. Or you can help people find a dentist that takes their insurance and help them solve any barriers to getting there. Here is another opportunity to pause and consider what you would do in a particular situation. A person you work with has severe tooth decay. After many years of not caring for their teeth, they feel ashamed of their teeth, so they do not bring it up very much. But once in a while, they do mention something about their bad teeth. What would you do? What facts might you share? How would you address the shame or stigma they feel? In conclusion, this lesson has shared many facts about the home care habits that support oral wellness. You have learned about specific oral health tools, such as fluoride and toothbrushes, and you have learned how people can use these tools with proper technique. Take a moment to think about whether anything you have learned today has surprised you. You make a huge difference in someone's life by helping them address barriers to proper home care. You can improve someone's knowledge of oral wellness tools, which may help them see the value of home oral care. And you can help people find affordable oral health wellness tools and make smart choices about which ones to purchase. In the community where you work, you might already know where to find the local food pantry or medical clinic. Wouldn't it be a great addition to your work in the community to also know where to find affordable oral health wellness tools like toothpaste, toothbrushes, and floss? The main take-home message in today's lesson is that what people do at home is the number one factor in keeping their mouths healthy, and that it is never too late to improve oral health. If you help someone see that it is not too late, you can make a difference in their life.